Hi guys, today we're going to be talking about vertigo. It's a pretty common condition we're going to be seeing in clinics throughout pretty much our entire careers. So, to go into it, vertigo is a sensation of spinning or whirling that can cause issues with balance and affect ADLs. There are two main types of vertigo, peripheral and central. So, peripheral vertigo is the most common type of vertigo. It occurs when there's an issue with the inner ear or the vestibular nerve. Subtypes include benign paroxysmal positional vertigo, or BPPV, labyrinthitis, vestibular neuritis, or Meniere's disease. So, one of the main ones there is BPPV. Essentially, a problem occurs in the inner ear where an otolith from the utricle in your inner ear comes out and comes into one of the semicircular canals. When that happens, it causes the fluid to shift when you shift from one position to another, causing symptoms that are dizziness or spinning when you're not actually moving yourself. So that's one of the main ones. Central vertigo is less common and is usually caused by conditions affecting your brain, such as infection, tumors, TBI, or other things that are more major than just an inner ear condition. Some of the possible causes of vertigo: head injuries, TBI, ear surgeries, diabetes, stroke, migraines, MS. Can be a side effect of a lot of medications, and brain infections are a big one too. All right. So, vertigo or dizziness affects 15 to 35% of the general population at some point in their lives. Vertigo is one of the most common reasons for ambulatory care visits. So, when people are dizzy or have nausea associated with vertigo, it's a pretty common thing for them to go to the doctor about it. When it comes to when they go to the doctor about it, most of the vertigo that gets diagnosed is peripheral, about 80%. The other 20% is the central. So, physical therapy intervention for the problem. One of the biggest things, especially for BPPV, is the Epley maneuver. It's a maneuver where you're changing the patient's head positioning in order to get that otolith back into the utricle instead of in the semicircular canals. So you start them off with their positioning, you drop them back really fast, keep their head turned, and you turn them to the opposite side and bring them up to get that otolith repositioned where it needs to go. For other types of vertigo, there are other treatments as well. It can also help with BPPV. So gaze stabilization training. So vertigo a lot of time will also affect things when it comes to looking. So turn your head left or right to look, up and down, can cause dizziness in terms of a lot of the vertigo. So that goes into the next thing, which is also habituation training. So when you combine those two, the more you get people used to stabilizing their gaze when it comes to looking around and habituating them to the change in head position or body position, the more likely they are to not experience the dizziness or it not affecting them as much. You can also mobilize the neck and head to better help them. So in some cases, like the Epley maneuver, you're positioning them as they go so that they're better able to displace the otoconia and get it back to where it needs to go. So there are other cannula through position and maneuvers as well that can be just as effective, if not more effective, than the EPO maneuver. Something else that goes into it, especially with physical therapy, is balance training. So the vestibular system is very important in balance, but it can also be attributed to from the body itself as well. So if they have instability in their lower extremities, then it can also contribute to how that vertigo affects them. So you want to get their other balance systems trained as well so that they're able to better go about their daily lives. So other medical interventions, one is medication. There are several medications that treat vertigo, or the symptoms at least, because it can cause nausea and vomiting. They'll give you medication and it will treat that to help it go away. In terms of central vertigo, a lot of the time they'll have to remove one of the central causes. So in this case, if it's a brain tumor, or if it's an infection, they have to get medication to treat that infection to get it to go away so that it's not creating the symptoms of the vertigo. And then other medical professionals can also do the repositioning techniques and the VRT. The reason I chose this topic is I have a grandmother that has vertigo. She's had a lot of falls, a lot of lengthy recovery. She's broken a hand. She's had several fractures in her radius and her ulna. And we've had to help her get over that several times. I also find it interesting that it's one of the systems that affects so much of our daily lives if it's impaired. Because if the vestibular system gets that way, sometimes we're not able to drive, walk, or do anything else because we're almost incapacitated by that. That's going to be my presentation on vertigo. Thanks for listening, and I hope y'all have a great day.